Good morning, everyone, and welcome to our second webinar in the vaping series. This one is Vaping Education versus Punishment Using Deferred Citation. This webinar is presented by the Great Lakes ATTC, the Great Lakes MHTTC, and the Great Lakes PTTC. We are all funded by SAMHSA to support the behavioral health workforce in Region 5, which is Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. And we welcome everyone out in Region 5 and outside of Region 5. Our work is funded by SAMHSA on these funding sources. Our SAMHSA disclaimer is that the information presented in this webinar are the opinions expressed here of the speakers and do not necessarily reflect the official position of SAMHSA or DHHS. Our webinar format today will be recorded and available for viewing along with the PowerPoint slides on the Great Lakes ATTC, MHTTC, and PTTC websites. It usually takes us a couple of weeks to get everything ready to go and up on the website. Your audio will be broadcast through your computer speakers, so please make sure that your speakers are turned on and up. There is no call-in number available. You may use the chat box feature throughout the webinar to ask questions or add comments. Our speakers today will ask questions during the presentation as well as if there are any left after. Our speakers today are Tim Wavrunek. Tim has 23 years of experience in human health services field. He has served as the Executive Director of the Eau Claire County Restorative Justice Program since 2005. In this role, he's responsible for day-to-day operations of the program, ranging from administrative and budgetary duties to staffing and direct service provision, including victim offender conferencing, peace circles, accountability workshops, and at-risk accountability mentoring. Our other speaker today is Kim Koller. Kim has been an educator in the Eau Claire Area School District for more than 20 years, serving as a teacher, a principal, and an executive director. As the Executive Director of Administration, Kim supports school administrators in creating a safe and supportive learning environment for all students. And I'm going to turn it over to Tim to get started.
Great. Thank you very much, and thank you everybody for joining us today. And just to start off with, I want to say that we're very pleased to have been asked to be a part of this webinar series. Today we're going to be talking about the process that was developed with the partnership that you see up on the screen now between the Eau Claire Area School District, the Eau Claire Restorative Justice Program, and the Eau Claire Police Department. These are the three main players that came together to develop our process, although there have been many people who have been helpful and assisted us with putting this together and getting it into full implementation. As was mentioned before, we are more than happy to take questions during the presentation for clarification's sake, as well as just timeliness, so that we're asking questions or answering questions that may be particular to any given slide at that time. So please ask your questions as they come up, and we will do our best to get to them. We're going to cover a little bit of history as well with our community, how this all came about and why it all came about. Obviously, vaping is a very hot button issue throughout the United States and elsewhere. We just would like to voice our appreciation to everybody for allowing us to show you what our part of our answer has been to this epidemic. So with that, I'm going to turn it over to Kim to talk a little bit about our community and what our population looks like that we're currently serving.
So good morning. My name is Kim Koller. I'm the Executive Director of Administration in the Eau Claire School District. Just a little bit of history on Eau Claire. We serve right now about 11,500 students. You can see our secondary students listed there. Our high schools serve roughly between 1,500 and 2,000 students each. McKinley Charter School is grade 6 through 12 charter school. And then our middle schools have quite a variance in the number of students they serve. We have South Middle School, North Star Middle School, and DeLong Middle School. We also have 13 elementary schools in the district and one early learning center that focuses primarily on 4K. Our work with Eau Claire Restorative Justice and the Eau Claire Police Department around vaping really has focused on our middle school and high school students. Certainly we've not been immune at all here to the vaping epidemic. It is quite socially acceptable among high school students, certainly, and many of our middle school students will also find it socially acceptable. And really when we talk with students, what we find is they are not at all aware that there could be short-term or long-term effects to vaping. They really see it as harmless and a harmless way to socialize, to maybe interact with peers, and or to fit in. So we see kids in our schools that are simply vaping some of the flavored pods, and some students that are using vaping for nicotine, and other students that are using it to access other drugs. And we see this not only outside of school, like in the parking lot or at school events, but we also see it within our schools. So in the restrooms, in the locker rooms, and believe it or not, sometimes it can even happen in our classrooms where students are vaping and then exhaling into their sleeves, and the teachers might have no idea that it's happening there.
So part of why restorative justice became involved, I've had the question many times, how is vaping a fit with restorative justice? And I'm the first one to say that our program is by no means any type of expert on vaping. We're aware of the health effects and detriments. We're also aware of a lot of what Kim just talked about, using vape carts and or other devices to access THC and other drugs that have become available on black market levels. And ultimately, our program is involved because a lot of kids were becoming involved with negative law enforcement contact. And what we know about students who become used to negative law enforcement contact is that it can start a very significant spiral into continuing those patterns. One of our program objectives as restorative justice is to either divert, intervene, and or take the place of those negative law enforcement contacts so that we can address it more on a restorative level, but also an educational level. Just a real brief number sound off for the 2018-19 school year. School resource officers in the Eau Claire district responded to almost 2 vaping incidents per school day. And so while that ultimately adds up to a few hundred contacts, what we know is also that that's also a few hundred open cases that law enforcement was responsible for adjudicating and then also determining to what level that would rise, whether it was just a cite or a counsel and close, or possibly a referral to juvenile justice programming through Department of Human Services. When a case is opened, that exponentially increases the work of school resource officers. And they were being bogged down by dealing with vape incidents and cases where they would have to talk to multiple people and do multiple searches perhaps and track kids down, and they weren't always where they were supposed to be. And so it was taking up, and anecdotally I don't have the exact number of hours, 2 to 2.5 days of a school week for resource officers at times were spent just dealing on vaping. and then taking away from what school resource officers are there for. Ultimately, even though this is a citable offense and it is an ordinance violation, the greater cause for concern was it was taken away from the time to ensure a safe environment in our local schools, which brought great concern to the SROs as well as to the higher-ups in the local police department. So quite a few were being opened, and they were just getting overwhelmed with all of this. Ultimately, what brought this about? In the winter of 2018, our program received a referral for 6 middle school youth who were vaping THC oil. THC oil, for those of you who are not familiar or may not be familiar with it, there is no accounting for what's actually in it. Many of the media-focused cases where there have been significant illnesses and resulting in death have been attributed to black market THC carts that were being filled in basements. Right here in Wisconsin, we had a significant case, I believe it was in Racine, hundreds and hundreds and hundreds of illegal THC cartridges. Obviously, they would all be illegal in Wisconsin. Tens of thousands of dollars in cash, and these were brothers who were selling it literally out of a basement, to the point that they had staff that were clocking in and out on the time clock, so they were getting paid by the time they put in. And of course, with middle school youth, any type of inhalants or ingestion of AODA substances that either were or were not subscribed to them or prescribed to them, or they were just sharing or taking from other people, was of great concern. During the meeting, we were teaming this particular case with a school resource officer, school admin, juvenile court intake worker, and our program. The greater issue of vaping was brought to light for us by the local law enforcement, SRO, school resource officer, supervisor. And so that started the discussion about what can we do to address the tens of dozens of vaping incidents that were being experienced on the school level, and really sucking up a lot of resources that, you know, if you work in a school or with schools, you know, aren't very readily available.
I think also related to that is we were seeing from a school level, although we had lots of citations and we had lots of involvement from our SROs, the behavior wasn't changing. So when Tim said it's on average 2 a day, it was fairly spread out. It wasn't that there were, 41 month and only 5 after we intervened the first time. It was consistently 2 a day for the entire school year. So as a school district, when we looked at things, we really were perpetuating that response to engage our SROs and look at a consequence-based response to vaping. So what I have here is Eau Claire School District policy, which you can see was updated with vaping. In that very first sentence, the ECASD school board recognizes that the use of tobacco products and vaping devices are a health, safety, and environmental hazard for students, staff, and visitors. And so we had updated it from the previous policy that really discussed tobacco only. And I think when we updated that, we were looking really to treat it the same as tobacco. But socially, it is not the same as tobacco to students. And then if you look at the next slide, we also outlined that consequence-based approach within our rule to that policy. And so when that policy was updated to include tobacco and vaping products, you can see here if a student under age 12 violated that policy, we would suspend the student either in school or out of school. They could be referred to juvenile intake if the principal determined, and we would involve parents and guardians for our elementary kids and some of our 6th graders. But if students were over age 12, really our policy dictated that a citation would be issued. And in addition to that citation, we might look at a school-based consequence, such as an in-school suspension, but really that citation, that was our practice. And we kind of took the consequence-based approach to tobacco and vaping. So the historical practice then, what it meant was when I was a principal, if a student were vaping at my school, I would immediately hand that over to the school resource officer. So we viewed vaping as really almost a criminal activity, handed it over to the school resource officer, who then interviewed and investigated the violation. So as a principal, from that point forward, I wasn't very involved, other than finding out what happened to the student after the SRO investigated. Right now, what we do, so this started, this flow chart that you see here, this is our current practice, and really started within the last 6 to 9 months through the partnership with the police department and Eau Claire Restorative Justice. We now look at vaping on campus as an educational opportunity for students. And as a principal, this really is my decision-making tree. So when a student is vaping on campus, the first thing that I need to determine is whether or not THC or another drug was involved in the vaping. If the answer to that is yes, we do refer it immediately to the school resource officer. If we know that an illegal substance was involved, it goes straight to the resource officer. If the answer to that is no, we really then begin to look at how do we educate the student and how do we help them make a different choice in the future. So the next thing we do then is really look at the student's behavioral record and see, had they participated in the restorative justice program for vaping previously? If they haven't, we try to steer them in that direction. So if the answer to that is no, they haven't, principals will meet with the student and family, and we will talk with them about the restorative justice program and the opportunity for education and learning more about vaping as an option. So the restorative justice program is always an option. If the family and the student agree to it, we do pursue that option. If they're not interested, then we do not. We send them to the SRO. So if they're interested in participating in restorative justice, the student is referred to restorative justice, and we defer their suspension. So if, for example, I vaped today at school and the next restorative justice course is on Thursday, I would be suspended, not today, but I would be suspended on Thursday, and would use that time to complete the restorative justice class. If the course, we get confirmation that the course is completed, then our intervention is complete. If a student says that they would like to take the restorative justice class, but do not follow through on that, it does go back to the SRO. We expect students to follow through on participation in the course.
So we have a few questions. The first one I will turn over to Kim. If a student was 18 years of age, would the SRO still be involved?
Yes. Yes, so our SROs will, they interact with all of our students through graduation, so they don't age out of school resource officers. So remember, this is, so we live in Wisconsin. THC or other drugs would be illegal for anybody at any age. So our SROs still serve as our contact for students even if they're 18.
So our next question is, how are you paying to test the substance in the device? Through our agreement with the the Eau Claire Police Department and the SROs if there's any question or concerns, doubt that what the students are inhaling is anything other than nicotine. Law enforcement will still do a field test on those particular vape cartridges. Of course, we run into some of the situations where it is just flavored vape, minus anything, any nicotine, THC, or any other substance, in which case it is still handled as a school disciplinary issue instead of a law enforcement issue. So the only reason that the youth would be sent to an SRO in the case where it is nicotine is if they chose not to take us up on the opportunity to go through the Catch My Breath program through restorative justice. If they choose to, then it's handled strictly as a school disciplinary issue instead of a law enforcement issue. And that meets our objective through the restorative justice program of trying to divert for low-level, minor type of offenses that could be better handled through education from negative law enforcement contact. Which restorative justice class are you using? It's not a restorative justice class. Our program is facilitating the Catch My Breath program, which if you were a part of the webinar last week, the first part of this series, I believe they went through the Catch My Breath program, and we'll talk about that a little bit in a little bit down the road as well. Does the same educational response apply to staff faculty violations?
I can talk with that.
Sure.
So we are a tobacco-free campus and drug-free campus. So staff violations are actually handled through our HR processes and within the staff handbook. So the answer to that is no, we do not have staff go through the restorative justice.
All right, so just a good image of how it was then versus how it is now in regards to vaping on the Eau Claire School District grounds. In the past, use of tobacco, vaping, and drugs on campus was prohibited. That remains the same today. The strategy in the past, however, has changed through the use of education versus, in the past, the use of consequence. The families are informed, they are given a say in this, and all families are contacted by school administration when their son or daughter is found to be vaping or in possession of vaping devices or other paraphernalia on campus. They're informed. It changes a little now because we bring the family in to talk about the opportunity to have a different type of an approach so that their students can come in, get some information based in fact instead of based in advertising or based on hallway news or bathroom news or whatever you would like to call it about vaping and the drawbacks to it versus what they may be hearing. In the past, the agencies that were involved, school resource officers and potentially the juvenile justice system. At this point, through the restorative approach, we have added school staff as part of this process and decision-making process. Excuse me. School resource officers, restorative justice staff, family members also are part of that. We've had extended family members who have come to us with concerns about particular students. And so we're trying to involve the team approach, a coordinated services team approach almost, so that we can reasonably be assured that the student, if they're looking for supports outside of just being referred to supports, that those supports can be identified around them as well. What we know about the previous approach, vaping has exploded over time. What do we know about this brand new approach that we're talking about today? As of right now, not a whole lot, and there's many reasons for that. This has been in play, this process has been in play only since the middle of September. Our program consists of 1.75 FTE staff, and so in addition to the vaping, we have our, I'll do air quotes that nobody can see, regular restorative justice duties that need to be attended to as well. So our plan is that after the first semester, so about another month in the middle of January, the first semester ends for the Eau Claire School District, we will be contacting our referral sources for the vaping education to determine a number of things. One of them, of course, would be reoffense rates, reoccurrences of vaping on school grounds, but also to see if any other students have approached voluntarily to take part in Catch My Breath through restorative justice. And so we are going to be determining what this looks like compared to the previous approach down the road. So a few more questions. Who coordinates the process of managing the students going through the whole process? The school administration, it could be a principal, dean of students, vice principal, whomever makes that referral. Once that referral gets to our program, we document everything from there on out, we being the restorative justice program. And we keep it as simple as possible just because we also know that everybody is buried in paperwork and everything else that goes with it. I'm going to jump ahead a couple of slides here to show you. This is our referral form. It's very simple, some basic demographics, contact information, and signatures of involved parties. We receive that referral form, and then we use that exact same form to document. If you can see right in the middle, right in here, is for RJ staff, restorative justice staff, to document whether they successfully, the students successfully completed or not, and if they did not, the reason why. We've had a few no-shows, not very many. We have not had any student who has attended not successfully complete. So upon completion, that part is filled out and sent right back to our referral source, be it a principal, dean of students, vice principal, whomever that may be, and then they can close that disciplinary case on the school end once they receive that. If it's an unsuccessful completion, back when we went through the flow chart, either through no-show or they blew out of class, then that would be referred to law enforcement for the $50 tobacco citation. Are we requiring students to attend out of school Saturday or at other time for Catch My Breath?
Can I talk about that?
Sure.
That was a lengthy conversation between Eau Claire Restorative Justice, the Eau Claire Police Department, and the school district because we wanted to remove as many barriers as we could. So I think our dream would be that we would have scheduled classes during the week at each of our secondary schools. We have 5 secondary schools, 6 with McKinley, and Tim said it is him and one other person at Restorative Justice. So part of what we're doing this first semester is really looking, just trying to get a feel at how busy are we keeping Tim and his colleague, and what is or isn't working within the program. So what we have right now is an agreement that we will defer suspension so that the student misses school to attend the vaping class, but doesn't have an in-school or a school-based consequence of a suspension, and then 3 days later has to miss again in order to attend the class. We want those two things to coincide. There's also a question about what if a student is a repeat customer? We offer the course once. So a student is offered restorative justice once. If they re-offend after that point, then they do go back to a consequence-based approach of being referred to the school resource officer and a potential citation.
And the reason being, again, going back to, well, what does this have to do with restorative justice? Like I had mentioned previously, our objective, one of our main objectives as a program through restorative justice is to offer an educational opportunity versus law enforcement-based consequences to kids. In speaking with some of the developers at Catch My Breath when I ran across the program this past summer, I explained what we were utilizing, what we wanted to utilize it for, and how we wanted to implement it. Catch My Breath is designed as a preventative classroom-based program. So that being said, we, in discussion with the developers in Texas regarding the utilization of the information and the format of Catch My Breath, came to the conclusion it had each and every piece of information that you would use on an intervention level as well. Now, it does not meet fidelity requirements as a prevention program the way that we are currently utilizing it, but we're also utilizing it with students. For some students, it'll be a starting point. Other students might take it to heart, and typically, what we have found with other programming that we've provided is that the earlier that we get them in, the higher chance of success. And so in discussion with Kim previous to the webinar beginning today, we do an informal survey at each of the classes that we hold for our vapers. And we ask, do you have any plans on stopping, or are you just going to continue? And the vast majority of middle schoolers said they would like to stop. And for those who ask for help in doing so, we connect them with other resources in the community for nicotine cessation programming. The majority of our high schoolers, they don't really have any plans to stop. And so our best goal that we're meeting is an opportunity for them to divert from formal legal consequences through negative law enforcement contact. But also, it's always been an objective of mine that when students or juveniles walk out of our program, we try to be as complete as possible in the information that we're presenting. And I don't want them to be able to say, well, I didn't know, nobody told me that. And if you're not familiar with Catch My Breath, we're going to play a little clip of it in a few slides. But please go to the catch.org website and familiarize yourselves with the program, as it covers everything from social influences to advertising, truth in advertising, health risks, and the differing effects that vaping has on developing brains, as well as long-term potential consequences. And I just see that we're not able to play that video. It's an introductory 2.5-minute video that everybody can access on the catch.org website. The Catch My Breath program, it's a beautiful thing. It's free for anybody who wants to use it, and that, of course, was a big selling point on our end, but also those conversations that were held with the developers were a key aspect in us in using the information from Catch My Breath in this intervention process. We have a question: are restorative justice staff employed by the school or other? Our program here in Eau Claire County, Wisconsin, is actually a program of Goodwill Industries, North Central Wisconsin. We have been housed out of Goodwill for the past 19+ years, and we are a private nonprofit agency. And yes, Goodwill is the Goodwill stores that everybody hopefully is familiar with. And so we contract with some county referral sources, but as far as school referral sources, we receive a general allocation from our county that allows us to provide a certain amount of services at no fee to other entities within our service area. And so the Eau Claire School District obviously is within those boundaries. And so, yeah, we are employees of Goodwill Industries, North Central Wisconsin. Next question we had, and I'll jump around if that's okay with everybody. How many referrals are we seeing to date? And this is current as of last Friday, so probably add another 5 or so to these numbers. To date, we've had 79 referrals for the deferred citation process. 73 of those referrals were successful completions and 6 unsuccessful. Each of those 6 were failure to show. There was nobody that blew out a group or walked out or was disruptive in group and had to be asked to leave. They were just students who chose not to show up to the Catch My Breath program.
Do we offer, does the district offer cessation services for youth interested in quitting? Tim and I were actually talking about that before we came on today, along with what have you found to be the best community-based cessation program. We do not in the district offer cessation services. Like Tim referred to, if students express an interest in wanting to quit, then you do have community-based programs that you utilize?
Through local medical providers, there are a couple of nicotine cessation programs that are available. However, they're also scrambling to catch up with the times, meaning basically the way that the nicotine is ingested. While smoking and using smokeless tobacco has long been the norm for kids who have been accessing nicotine, the whole vaping issue and the different social aspects that it brings with it, as far as how it's looked at not only by the general public but by the juveniles' peers, adds a little extra wrinkle to it. It's become the social norm for teens accessing nicotine, and so they're struggling to get into place the appropriate measures to deal with it. Trying to make sure that we cover all the questions here. What else could it be besides TH or nicotine? There are actually just flavored juice pods out there. We haven't run across anything. One of the big pharmaceutical issues in our area right now with juveniles is juveniles accessing Xanax. I'm just waiting for the day that Xanax ends up in a pod or a cart and is used as an inhalant. I don't know the mechanics of that or the pharmaceutical processes, or if that's even something that would be an effective ingestion method. But right now, the main ones, of course, are nicotine, THC, and then the flavored pods.
Do we offer a separate curriculum or lesson to general student body as preventative education versus response to behavior? We do have some lessons within some of our curriculum, but I think what we need to do as a district is be more systematic about that. So right now what it has been is teachers responding or schools responding to what's happening with our student body or within the community. But as a district, we do not have a comprehensive educational or preventative program, so that's certainly something that we want to put into place. Moving a district of 11,000 to 12,000 students takes a little bit of time, and so that's probably our biggest barrier right now, is how do we do something across all 20 schools consistently.
And so to piggyback on that, the Catch My Breath program was developed as a classroom-based curriculum, preventative curriculum. Again, we've gone over how come we're using it and why we're using it in the manner that we are. As a total, the whole Catch My Breath program can be completed in about 40 to 45-minute class sessions. My hopes are that this moves out of just being the restorative justice response to this being presented in health classes. It can also be presented as part of Phy-Ed class curriculum. We have a neighboring district that, as soon as they heard about this new process, wanted to jump on it because they're affected just like everybody else is. At that point, and currently, until we get a grasp on numbers and capacity, what we can handle through our small program, they have in turn taken the Catch My Breath curriculum, and they're doing their own internal diversion process. This is a much smaller district than the Eau Claire School District, and I am going to be following up with them within the next couple of weeks to see how their internal process is going. They're utilizing basically the same flow chart, but keeping it internally, internal. And so when a student is caught vaping, they will receive an in-school suspension, But then during that in-school, they will be going through the Catch My Breath program. Again, it's being used more as an intervention than a preventative manner, which we understand. But the fact is that everybody is so swamped with this that people are grasping for anything to get some actual information out there.
I did see a question, and I don't remember exactly what the wording was, but basically, how many students are choosing this, or do we have students that refuse it? We have incentivized this. So a citation in Eau Claire is $50. So if you are vaping on school grounds, the citation will cost you $50. We have a $25 fee for the Restorative Justice Program and Catch My Breath for the administrative costs, and the work that Tim and his crew do. We have, as a district, also applied for grants from our local health care and some of our other industries around here to help cover the $25 cost and make it free. We do have some funds available, like we can remove barriers for students who wouldn't be able to pay that cost as well. But having it being incentivized with the lower cost than the citation, I would say has been successful. We've had a lot of students that are choosing it. So when you look at the 79 students referred in 4 months, it's about 20 students a month that we're referring into the program.
We have a question whether any part of Catch My Breath be self-administered due to a lack of staff resources to do in-person classes. Like I said, Catch My Breath is open to anybody. They prefer that school districts or individual schools register for use of that. Students can definitely access the information. It's pretty much all video and slide based. There are some really cool handouts and worksheets and also assignments that I would recommend, in my experience, be facilitated by an adult, be it a school staff, a liaison officer, health educator, whomever that may be. It's easy to sit in front of a video or a computer and just wait till it's over and then move on with your day without any absorption of the information or materials. And so during our classes, we engage the students in conversation. We ask questions specific to their vape usage, when they started, why they use. As I had mentioned previously, any plans on quitting, and would you like help with that, accessing programming for help with that. There is always going to be more benefit in that relationship and rapport building than just sitting in front of a screen. Can the information itself be looked at? Yes, it definitely can. I would question how much of the information would then be absorbed and let alone put into play after that. Our middle school age more receptive to programming. We haven't, our first check-in this year was about the second week in October, and by check-in it was Kim and I checking in with all the principals at the schools that were listed earlier on in the presentation. To that date, not one of them had any student turn down the opportunity to take us up on the Catch My Breath. Of course, now we're looking at that's a couple months ago, but we will be going back, and that will be part of the examination after the first semester. Are students turning it down, and if so, are they saying why? Like Kim had mentioned, our goal would be that we remove any financial barrier to students taking us up on this educational opportunity. Reality dictates that we have to keep the doors open and lights on just like everybody else. And so if we were able to remove that financial barrier, it may provide more of an incentive at that point in time for kids to take us up on it. But overall, it has been very highly accepted by all students. Do you come across teens vaping CBD? The answer to that is we don't know, because CBD still tests positive for THC. And so at that point, the officers would the school resource officers refer to juvenile court intake for possession of THC. Their field test kits do not break down levels or anything of that nature, so their policy is that they refer it to juvenile court intake, at which point they probably end up in our program anyways through our AODA workshops that we do. But without having the capabilities or resources to test any further, there may have been some CBD cases that were referred as THC violations.
You want to talk about the cessation?
Sure. We are fully aware that this approach does not deal with full-blown addiction. Kim and I were actually having that conversation previous to the webinar having started. If the best that we get out of it is a foot in the door, and we start that conversation with kids that, you know what, I'm really struggling with this, and I've tried to stop, and I'm right back to it, at least then we know. And so we do know that this is not a cessation approach, although it may open the door to referrals to cessation programming, which would be beyond the scope of our program. A lot of cessation programming that I've looked at are 10 to 15, 16 weeks, and it's not something capacity-wise, nor is it our expertise area that we would be comfortable even offering programming like that. We're hopeful that our community partners, whether it's Mayo Clinic, Marshfield Hospital, Sacred Heart Hospital here in the Eau Claire area, if they were to start offering some nicotine cessation programming specific to vaping, we would definitely fill some seats for that.
We also know, and I think you can look to the adult justice system as well, it is consequencing somebody out of addiction is not a successful strategy most often. So when we look at students who are addicted, whether it's to nicotine or to other substances, we try to approach it from an educational and a health-related standpoint, not a consequence-based decision-making, because ultimately what we want is to be successful and to help the students kind of get where they need to be as far as their own health and their addiction.
Another question we had, how do you handle students who may have a prescription for medical marijuana? Well, currently in Wisconsin, that's not an option. And so that is not something that we have to navigate at this point in time. Should that change down the road, of course, that would be something that districts would have to look at their policies, and then also how that is navigated ultimately systems-wide. But currently we don't have to tread those waters. And there's a question, did you look for other alternative suspension programs before deciding to go with Catch? I did. I found nothing vaping specific. This was the first one that popped up on my radar, not to say that there aren't others out there that may be available, but I was scrambling for a few months trying to find what we felt could be implemented in a way that makes sense programmatically for our small program, also for the school district and the objectives that the district was looking at, as well as law enforcement. And so we would have considered any and all programming, suspension programs, whether it was vaping specific or not. I guess I'm not too sure if suspension programs are specific to vaping or how the question asker meant that. But Catch My Breath was the first one, and it was a breath of relief for me because we were coming up mid-July by the time I ran across it and by the time I spoke with the developers, and then we were able to pull together all the parties, the district, law enforcement, juvenile court, to put this process into play. We were right up to the start of the school year. So Catch My Breath was the first one I found that made sense and that we felt that we could put into action that would make sense for everybody.
Can you go back one slide?
You bet.
I saw a question about demographics and data and what are we seeing along the lines of who is vaping in Eau Claire, what are the trends, and that sort of thing. So this is our implementation outline. You can see really in 2018 we started having this conversation really around looking at what is the data around vaping in Eau Claire and the interventions that we've tried, and to be honest with you, the lack of success with those interventions, and then discussion really around the impact on students in the school environment. So when we looked at the amount of time, for example, that our SROs were spending on vaping, that's time that they can't be spending developing positive relationships and impacting the school environment. So those were some of our concerns, and that really was the impetus of wanting to do something different. So last winter at this time, and then early spring 2019, we really looked at developing a process. So what would the process be between all three agencies that work together to make this happen? So within the school district, within law enforcement, and restorative justice. And we spent some time kind of unpacking that and talking about who would come to the restorative justice program and who wouldn't, and what would our objectives be. And so this fall we started to use the restorative justice program for vaping. So it's pretty new. We're only 3 to 4 months into it, and that question about what are the demographics, those are some, like, we want our cell size to be big enough to be confident in what we're seeing and what we're reporting out. So like Tim said, we're waiting for this first semester to come up with some initial data, and then we'll pull people back together and take a peek at what we are seeing within that data. I will tell you that the Eau Claire School District as a whole, we are disproportionate in many areas, in that if you are a student of color, if you are a student who lives in poverty, odds are you will have more interaction for lots of resources within our district. So you're more likely to be in special education, you're more likely to have office discipline referrals. So those are, I wouldn't be surprised if our data mirrors that, because that is something that we actively need to continue to improve in Eau Claire. So we will see once we run the data after this initial implementation.
So we have a few more questions we want to get to make sure that we're answering everything to the best of our ability. There was a question about, are we letting students know about this is Quitting app for Mayo Clinic and the Truth Initiative, and we do direct them towards that in the groups that we hold. However, we have we don't have the capability to follow up with them to see if that's something that they are currently utilizing. We do let parents know who stop in to chat with us regarding the involvement of their students with the Catch My Breath program about other resources, and those are two of the resources that we have definitely pointed to in the past. How are the sessions scheduled? 1 per week, 2 per week, 1 hour each? We do it all in one shot, like I said, in discussion with the developers, and to increase the likelihood that students will take us up on getting this information. We do it all in 1 2-hour and 15-minute session. Now separately, these sessions, if they were implemented through a health class or a Phy-Ed class, in total would be about 2 hours and 45 minutes. So it's about a half-hour shorter classroom time, air quotes, than would be in an educational setting. Instead of giving them homework to take home and do, we role-play some of the homework sheets, especially with the middle school classes. But we've also found a greater engagement recently with our high schoolers who are really digging the role-playing and whatnot, which is not a huge surprise. So we're going to up the role-playing of the different scenarios that are put into place. One is an interview process, interview somebody who's been smoking and has quit, and interview somebody who has never smoked. And so we have them interview each other, and then we encourage them to take it home if they've indicated that their parents are historically smokers or utilize vapes or whatnot, to get some more information from their home setting. And where do we physically hold the sessions? We physically hold them in the very room that we're coming from you today. At the Goodwill store here in Eau Claire, Wisconsin, there's a community room, basically a conference room, that we hold the groups in. We have contingency plans to have bigger rooms available if referrals were to explode through the roof, possibly down at the Eau Claire School District main office building, but other partners in our community that have allowed us to use their space in the past. For right now, our typical group has been about, the average is actually 6.5 students per group. So 6 students per group show up. We do them weekly. We offer them weekly, I should say. Typically, to have enough to make it feasible for us to do, we need about 4 students, which has not been an issue, to hold it fairly quickly. And so typical scenario is that this week will be middle schooler, Catch My Breath, restorative justice programming. Next week will be high schoolers. And of course, there's been weeks we've had to double up for one or the other just due to the volume of referrals. So we have about 4 minutes left in our presentation. Is the Catch My Breath program evidence-based? At this point, my last check, it was best practices-based. They are currently working on it becoming evidence-based. And in the way that they're doing that, they're asking for people who register to utilize the curriculum to report back on numbers and some other measures as well. But upon initial use of it, it is best practices, not quite evidence-based. That may have changed. It's been a while since I've checked in with them. It was quite the partnership with the University of Texas. CVS Pharmacies was involved. SAMHSA was involved, I believe, as well. Those are the main players. There are many other individuals and agencies, I'm sure, that if you just go to the website, you can see all the partners in the development of Catch My Breath. So
contact information.
Yeah, one last call for a couple last questions, and short of that, we've had some great questions, and we thank you for that. I would much rather be giving information that you need rather than just sitting here babbling and hoping I'm giving you what you need or want. But if there are any follow-up questions, you can see the contact information for both Kim and myself listed on this slide. I believe this webinar will be available in the next week or so, so that you can go back to it, access the PowerPoint and the contact information as well. You can access, just do a search for Eau Claire Restorative Justice or the Eau Claire Area School District if email would be more preferable. But in lieu of that, feel free to use our phone numbers as well.
One question about have we updated the violation policy to reflect this, which was interesting as we were putting together the PowerPoint. I was pulling things off from board docs. The violation, the consequences outlined for younger or older than 12 years old was rule, which was updated but apparently is not in board docs, so that's on my task list. So the short answer is yes, it's been updated, although if you do a search for it, it will probably take until after Monday's board meeting in order for it to appear there.
Short of any other questions, once again, I would encourage you, if you're not familiar with the Catch My Breath program, please check out catch.org. Whether you're a school district staff person, community health provider, counselor of any type, it is a great curriculum that we're working on moving back to being implemented, hopefully as it's originally intended to be, as a preventative tool through health classes, physical education classes. But also I would encourage everybody to look for alternatives to punitive approaches. Education is much more effective than punishment, and that being said, we encourage everybody to get creative with how you're dealing with this vaping epidemic, because we know from personal experience and professional experience, it can be quite overwhelming. And one of the key components to it is we had all of the key players at the table at the same time because we were all looking for answers. And building those relationships is not only important within the walls of the schools, but also outside of the walls in our communities, so that everybody can get out of their own silos and start making a greater difference when we combine powers.
And I would echo that. I think if you don't have a strong partnership with your local law enforcement agency or your restorative justice agencies, that is a great place to start. I will say I don't think the Eau Claire School District could have done this alone. We needed their help.
Well, thank you all for tuning in today. We appreciate your time and your interest and allowing us to present our little piece of the answer when it comes to vaping within our communities, but specifically within our schools. I hope everybody has a great rest of the week. Check out Catch My Breath, catch.org. It's a great program, free of charge. That's a great selling point. We wish you all well, and we look forward to hearing success stories. Thank you.
Thank you very much, everyone. And again, the PowerPoints and recording should be available on the Great Lakes ATTC, MHCTC, or PTTC websites within 2 to 3 weeks. Thank you.